Hello, everyone. Thank you so much for joining today's Wednesday webinar. As always, we're going to give it just a moment to allow the room to fill up before we get started. Thank you so much for joining today. We're going to give it just one more moment before we go ahead and get started. Good afternoon, everyone. Thank you for joining us once again for our weekly Wednesday webinar series. Today's webinar is on Health Equity IQ. What is it and how do we raise it? My name is Alsan Murtha and I am the moderator of this series. This presentation has been pre-recorded, but at any point during this webinar, if you would like to ask a question, you can still use the Q&A feature at the bottom of your screen. We will have a live Q&A at the end of this presentation. We have staff members monitoring these questions and any questions posed on our social media platforms, which we will pose to our speaker after the presentation. This webinar is being recorded and will be available to the community beginning Friday, April 28th. I am joined today by NHS Dr. Keri Norris, our VP of Health Equity, Diversity, and Inclusion. Thank you for taking the time to join us today. I will go ahead and turn it over to you to get us started.
Thank you so much, Alsan. Great introduction. I am equally excited to be here today to bring this topic forward. So we're going to go ahead and jump into the actual presentation. I'd like to acknowledge our sponsors. The mission at NHF is overarching for all of the work that we do. And basically it's looking at finding cures for inheritable blood disorders and to addressing and preventing the complications from these disorders through research, education, and advocacy. And in this, we work really hard to enable people and families to thrive. These are our NHF strategic imperatives, which go across the areas of access, chapters, innovation, organization, sustainability, and vision. And within these strategic imperatives, we also have priority action teams. Our priority action teams are focused on mental health, future therapies, rare blood disorders, ultra rare blood disorders, von Willebrand's disease, and digital health. I have no disclosures. So let's start by defining health equity. Health equity is achieved when every person has the opportunity to fulfill his or her full health potential, and no one is disadvantaged from achieving this potential based on their social position or other socially determined circumstances. So you say, okay, I understand what health equity is. I now need to understand how does it relate to what it is that we're doing? How does it relate to our ability to get across to communities? And so we'll go to the basics. Your IQ or intelligence quotient is your reasoning ability, your ability to logically put steps together, your ability to put facts together in order to draw conclusions or to make determinations. So therefore, health equity IQ specifically deals with the following: logical and sensible conclusions. Given the parameters of health equity is the fair and just opportunity to reach one's optimal health and optimal health outcomes for everyone. And in order to reach one's optimal health, we must ensure that the playing field is fair and just for all. And by this, we mean across all social determinants of health, there must be equity and fair access. So when we think about disparities overall across health outcomes and conditions, blood disorders, bleeding disorders, heart disease, smoking, substance abuse, infant mortality, diabetes, cancer, obesity, all of these outcomes, which look like the actual leaves on the tree. And then the social determinants are the branches. But we also have to look at the roots. Just because we can't see them with the eye does not, they're not there, right? And so within these roots are what we talk about as root causes. And with these root causes, we're thinking about things like structural racism, unemployment, poor quality schools, right? Provider implicit or explicit bias, food insecurity, being underinsured, uninsured, poverty, housing, any type of discrimination, poor quality of care, and also environmental hazards and toxins as well. When we think about these social determinants of health, and a lot of science in the past and articles in the past and much of published manuscripts in the past has spoken a lot about health behaviors and patient lifestyle factors and getting patients to improve their lifestyle factors or change things such as tobacco use and increase their exercise, their physical activity, and also address their nutrition issues. They talk with patients about their alcohol use and also any type of sexual activity, whether it's considered risky activity or not. Sure, those things are important, and we will continue to emphasize that. But in the totality of everything that contributes to poor health outcomes, that only comprises of 30% of health outcomes. So when we're looking at that 30%, it's not as large as everything else. So when we think about everything else, our physical environment, our socioeconomic factors, and then the healthcare system overall, which encompasses access to care and also the quality of the care that you receive, 70% of a person's health outcomes is attributed to all of those environmental factors, right? So the largest portion in percentage is associated with your zip code and where a person lives. Your zip code is more of a determinant than your genetic code. And a lot of this is around access to education, access to jobs, access to social support, access to better incomes, access to better workforce development programs, and then also access in regards to what healthcare facilities are within your reach, are within your area, and what facilities you will be able to access through transportation, if you have any. So when we consider these social determinants of health, then the Kaiser Family Foundation has done a wonderful job of breaking this down across these 6 boxes, right? So we're thinking about economic stability and everything that encompasses, neighborhood and physical environment, everything that encompasses, also education, food, community, safety, and social context, and of course, the healthcare system. And across all of those determinants are the interweavings of racism and discrimination throughout, right? And so we take a look at this and it looks overwhelming. But the first step is to become aware, which most of us are aware of the social determinants of health, and we are aware of health equity and what it means. And what we need to do is boost our IQ. So you say, well, you're kind of born with your IQ, you can't increase it. Think of it as equivalent to your emotional IQ, right? Your EQ, your emotional intelligence. And we use that every day in interactions in our personal lives and also in our professional lives. So we can enhance that EQ. So you can enhance your health equity IQ as well. As we move forward, then we need to think about where we have direct influence within the social determinants of health, and then where we need to partner in order to bring or bridge the gap on the social determinants of health and any health disparities. Because as you can see with the arrows, they all link to health and well-being, whether we're talking mortality, morbidity, life expectancy, healthcare expenditures, health status, or functional limitations. So what I tried to do was pull out a couple of boxes so I could give prime examples within healthcare system, economic stability, and community and social context, as well as, excuse me, as well as safety. So within economic stability, if we're looking at the determinants of employment, income, expenses, debt, medical bills, and support, then you think of different organizations or different entities that you can partner with to increase opportunities for community members or to alleviate some of the stress for community members. If you're talking about employment and you live in an area with high unemployment rates, then that's a matter of getting people skill sets that they can use. Since the beginning of COVID, we've moved to, more companies becoming remote, right? So why not develop people's skill sets and also develop their computer literacy to help them to be able to acquire jobs in new areas, right? So partnering with the local junior college, community college, or workforce development training will allow for opportunities for employment, which would increase their income, which will then allow them to not have as much debt, to be able to pay their medical bills, and also to receive any type of support from that particular program as far as gaining that employment, right? So that's one example. Under healthcare system, where we're thinking about health coverage, provider and pharmacy availability, access to linguistically and culturally appropriate and respectful care, and also quality of care, then we're talking about actually having curriculum that holds everyone accountable for cultural awareness, for cultural humility, for understanding their own bias and how it plays into the health outcomes for patients and community members. And then in that, then you're partnering with various organizations that speak to the need of your community demographic makeup. So if your community is multifaceted, and by that I mean it's extremely diverse. It's diverse in race, ethnicity, it's diverse in age, it's diverse in housing, and also diverse in knowledge and job opportunities, right? So you have some people who work professionally in C-suite positions, and you also have some people who are blue collar laborers. Within that, then you're looking at how to get providers of all kinds across the board to better understand the communities that they're serving, right? And that's boots on the ground efforts, that's collaborative efforts, that's community advisory boards, that's community engagement, engaging those unengaged communities. And with that, then you're bridging the gap, right? You're creating spaces and you're creating opportunities for everyone to have equal standing and to better understand one another. So that's extremely important. And then within the community safety and social context, then we're looking at social integration and support systems that are in place. We're looking at community engagement. We're looking at stress levels of community members, exposure to violence and trauma. And we're also looking at policing and justice policy. So within that, then you're partnering with neighborhood organizations that provide relief for community members. You're partnering with the community overall, and you're doing programs like Each One Reach One, right? So then you're engaging those people who have not been engaged prior, and you are also providing a support system for them through the local chapter or through these partnerships with other organizations. For instance, for community safety, if you're trying to get people to be more physically active and also more aware nutritionally, and you partner with a local YMCA to provide either free or sliding scale services for your community members, then you also have to make sure that transportation is not a barrier, right? And within that, then you are ensuring that they're able to physically exercise in a place that allows them the safety that they might not have with trying to exercise in communities without sidewalks, communities with high crime levels, things of that nature. So these are examples of the requirements for partnerships to move the needle on equity and to move us towards equity. It cannot be done in silos. It has not worked and it won't work. So what I'm talking to you about with these partnerships is something called systems thinking. And it's a transdisciplinary approach to problem solving, and it's not linear. So there's no one straight way to do it. It's all over the place. And I'll show you an example of that in a few minutes. It's considering the interconnectivity of society, right? And it's trying to understand societies and letting us know that how they're organized and how we have these different actors to interact with the overall healthcare structure, which is very important. What we have to do is look at the patterns within the system and find ways to improve future health outcomes and create high impact interventions. That can only be done through systems thinking and collaborative partnership. And the key word, collaborative partnership, also includes shared decision-making and having the lived experience experts at the very center or the very heart of what it is that we're doing. It's no longer just public health agency centric, with public health being the center of all of the solutions or medicine being the center of all the solutions and then branching out. No, the center of all solutions start with engaging populations who have not been engaged and also relying on the knowledge of lived experience experts to help us to branch out to systems that we need to have at the table. No one can tell you better what's going on in their community and in their lives than those with the lived experience. So this is what systems thinking looks like. As you can see, everything and everyone is interconnected. The issues that we have around social determinants of health, which have various barriers for community members to be healthy and have healthy outcomes, it doesn't rely solely on the shoulders of the patient themselves. It doesn't rely solely on the shoulders of providers as well. It is everyone's job to put their hand in the bucket, to do good, to interconnect, and to work together to solve these problems. It's a complex system which makes up an environment, and this is the environment in which we live, work, and play every single day of our lives. So it's important for everyone to come together to be able to problem solve together. In order to make true change that is equitable, we must work within these systems. And that's how you effect change. No one singular organization can do it all. No pieces and parts of organizations can do it all. And then that way, the things that you don't have direct control over, you can rely on partnerships with law enforcement, partnerships with faith institutions, partnerships with elected officials, home health agencies, nonprofit agencies, schools, hospitals, everyone needs to be involved. And notice that there are interconnectivities with different health organizations that are in green, and then blue organizations that are either elected officials or specifically related to emergency systems. And then you have the lighter blue, which are other organizations that are on the periphery. So you have faith institutions, which have a lot of influence, employers, and then also transit, because that's very important, especially with our community. And you are more likely to get funding if you partner with other collaborative organizations. So keep that in mind as well. So the importance, you heard me talk a little bit about cultural humility. Within systems thinking, you can't go into the partnership telling everybody what to do. You can't go into the partnership with saying, I know it all, and I already know what you're going to say. So let me just take over this meeting and do whatever. No, when working with diverse populations, we have to go beyond race, ethnicity. It's age, it's geographic location, it's ability status, it's literacy level, it's immigrant status, it's education level, it's socioeconomic level, and so on and so forth. Cultural humility is being self-aware of your own implicit, explicit, or systemic biases, and then having an understanding for the differences in other cultures. And with that, with those differences, you are aware, you are working towards integration, you're working towards understanding others. You have a respectful curiosity about others who might be different or who have a different lived experience from you. We've often heard people talk about cultural competence, and that part has been taught in medical schools and has been integrated into different things. But cultural competence specifically involves gaining experience-based understanding about cultures different from your own and being conscious and aware of those differences. It doesn't actually move the person into deeper relations where you build relationships, where you build respect, where you build trust, and partnership comes together from that. It's just simply saying, this is who I am, and this is my cultural perspective from which I'm going to view everything. And I've heard a couple things about your culture, and that's good enough for me. That's just being aware. That's just being health equity aware, culturally aware. It doesn't move you beyond awareness. And that's what we need to do. And that's why raising your health equity IQ is extremely important. And cultural humility is an essential skill for working with diverse individuals with different experiences, beliefs, values, and cultures. And this is how, again, you develop those trustworthy and meaningful interpersonal and interprofessional relationships. Extremely important to health equity IQ. And so all of these things together pull on systems thinking, being aware of the social determinants of health and their impact and how to partner and who to partner with, and the importance of cultural humility. So you say, okay, Keri, we've heard all of this and it sounds really great, but how do we do it? So let me just talk to you about what health equity IQ requires. It requires more than awareness. Be open to the fact that no one knows it all, right? Be curious, but respectfully curious about others. It requires that we put the community first in research, in partnerships, and in practice. Things like community-based participatory research, shared decision-making, asking about and implementing ideas that work for patients. It requires that we know who's missing from the conversation and what action needs to take place. We go and we find them, and we find ways to engage the unengaged. We find solutions for transportation, or we create mobile clinics, right? Those are the important things. And that's the innovation part of all of this. It's having empathy for history in oppressed communities. You don't have to go above and beyond and get savior complex or anything else, but you must acknowledge the mistrust of the medical health system that happens with our communities and within our communities, and you have to embrace anti-racist practices, right? We also must practice cultural humility. Look at everything from the vantage points of groups outside of your major group, your major gender, or your major members of the community. Look at it from the perspective of marginalized or minoritized populations throughout the United States. We must have a broad lens. Health equity lens is on at all times, right? We're not just putting on our glasses for a temporary point in time and looking through our rose-colored lenses. We have integrated it into everything that we see, and we're making sure that everything is fair and just. It also requires that we create and maintain space for partnerships. Those are non-traditional partnerships whereby we can assist with competing interests for social determinants of health, and we also embrace systems thinking. We also must understand those competing interests, having programming and events at times and on days when community members do not work. We must incentivize participation and provide food if we're asking families to participate during a mealtime. Last but not least, we have to reflect on the communities that we serve. And that means that we're being reflective of our communities. Our communities look like our board. Our communities look like our staff. Our volunteers look like our communities as well. And so that has to be reflective. That same diversity in age, in gender, identity, location, education, race, ethnicity, backgrounds, and medical coverage. These are some of the most practical steps for moving towards increasing your health equity IQ. I invite you to continue to join us and follow up on our health equity, diversity, and inclusion efforts. You can find more information on the NHF website. And I thank you for joining us today. I will take your questions now.
Thank you so much, Dr. Norris, for joining us live, and Dr. Valentino as well, too. Keri, every time I watch you present, I learn something new, and it's just dynamic in different ways. So really appreciate that, and thank you for that. We do have some questions that have come in, quite a few here. I will start right at the top. The first one comes in and says, as an advocate in the bleeding disorders community, what is something I can do as an individual to help move the needle towards greater health equity for my community?
So first of all, thank you for being an advocate in the community. See where the gaps are, see where the need is. So if you are active with your local chapter or you're active with national patient advocacy groups, then it's important to boost up your membership. So not just be a member, but perhaps join a committee. Perhaps if you have some innovative ideas or thoughts, be vocal about those things and make sure to participate in Washington Days as well.
Great advice there, Keri. Thank you. Next question that comes in says, I love the systems thinking, but also seems like a lot. As a local bleeding disorders organization or HTC, where should I begin?
So you start with the need of your community. No singular community looks the same. So you begin evaluating kind of where are we as a community, and then you prioritize the needs of the community and then begin those partnerships. For instance, if food insecurity is an issue, then form a partnership with food banks, form a partnership with other organizations that provide food and provide food assistance to families. And then you move forward. If workforce development or unemployment is an issue, then your local government can help you. There are plenty of programs throughout different counties in the US that partner and that provide opportunities for training for community members to learn new skill sets and also to transition into new jobs.
Great. Thanks, Keri. Another question that comes in says, I want to volunteer with my chapter on this topic. I talked to our executive director and they are on board. Is a needs assessment a good place to start with something?
Yes, it is. I'm sorry. I kind of came off camera there for a minute.
You're okay?
Sorry about that. So the big thing there with needs assessment is that you have to make sure that it fits your community. So the biggest piece is to ensure that you are getting at the heart of the problem, because you don't want to create a needs assessment and you have all of this extraneous information that doesn't work for your community. So I would say a step above the needs assessment is actually a windshield tour. Simply getting in your car and marking those vital services that are needed for your community members and marking what's present and what's absent, and then filling in the gaps there.
Great. Looking through here. Next question comes in that says, Dr. Norris, have you discovered unique issues faced by the bleeding disorders community, or are we like any other rare disease communities? Is there any uniqueness with us?
Of course, it's unique. There are a lot of similarities with other chronic diseases in regards to social determinants of health, and unfortunately also in regards to health inequities. But there are specific needs around the cost of treatment that's not as high for other individuals as it is for this particular community. And that is very concerning for me. So I am working diligently with the team here at NHF to come up with viable solutions.
Great. Another question that comes in. If I feel a provider is lacking in cultural humility, how can I advocate for myself and encourage more awareness?
So you first acknowledge that the provider is trying, right? And then you have a simple conversation with them. Your options are to take the opportunity to kind of educate the provider or let them know more about you, your medical history, also your cultural beliefs and values are very important in your treatment and care. Or you have the opportunity sometimes to be able to switch providers or change to a different provider if that's necessary, if it comes to that step. But the
Mhm.
first step is to provide education, talk about your belief systems, talk about what you value. It's important to let your physicians know that.
So, Keri, just speaking from some personal experience as well too. But that conversation could be a difficult one at times. Is there a good way to approach that? Do you have any tips or pointers on how to approach that conversation?
Sure. So I would simply, if the provider has said something that's kind of off,
Mhm.
then draw their attention to and say, I'd really like to address, the statement that you made and offer the opportunity for clarification. I heard this. So is this what you meant by that particular statement? Once they respond, then you have the opportunity to educate them simply on that. So you're asking for clarification upfront about what it is that you heard them say, and they can say, well, yes, that's what I meant, or no, that's not what I meant at all. And then that opens the door for you to be able to share.
Great.
That way, your questioning is not blaming, it's not finger pointing, but it does offer the opportunity to open dialogue, and they won't be on the defensive because it starts out as a point of clarification.
Yeah, that's great. That's great advice. Thanks, Keri. This is a bit similar, and I think you've answered this, but I want to put the question out there anyway. I've seen an issue with one of my providers at my HTC. What is a good way for me to approach them to express my concerns in a respectful way? And I think you just answered that. So much appreciated there. Those are all the questions that we have that came in. Is there any closing comments that you'd like to make, Dr. Norris?
So I would like to say to members of the community that the power is really in your hands. You have the power of choosing your providers and choosing to advocate in your best interest. You have the power to ask about services and ask for resources when there is a need. They cannot read your mind, and it's easy to be able to relay your information. If you can't directly talk with your provider, then use your network that's there. Talk with your social worker about what your specific needs are and how to problem solve. And if there's an opportunity for you to help grow resources at the provider's office or at the HTC level, then commit to participating on one committee or commit to participating on an advocacy board, commit to letting us know through CVR what your needs are and exactly what's going on and what your experiences have been. Commit to participating in BDC, commit to participating in Washington Days so that we can make effective policy change. And I think that, that is overall, and commit to participating in clinical trials and research as the core team and the core center of information that we need in order to drive research, in order to drive the future of innovation for bleeding and blood disorders. And my door is always open. We would love to, have you as a part of our health equity task force. We still have room on the task force. So we're more than happy to welcome you and to work with you going forward. Thank you so much.
Very, very good. Very good. And I will attest to that. Dr. Norris's door is always open, and I take advantage of that on several occasions. So please feel free to do the same. And and accept that invitation. So again, Keri, I learned something new every time I have a conversation with you. So thank you so much for being here, and thank you so much for taking the time to join us. For everyone out there, please note that this webinar will be available on our website under the events tab on Friday, April 28th at hemophilia.org. Thank you again for joining us this afternoon for the continued Wednesday webinar series. Again, Dr. Norris, thanks for your time. We truly appreciate it. Have a good
Thank you.
afternoon, everyone.
Bye.